the main answer that people are even looking for is there a way I can avoid doing the cream on my head and all the flakiness and the hassle? Well, there is, right? Another question that comes up a lot is hair loss. Now, I will fully recognize that it's kind of hypocritical for me to talk about, hair therapies because I don't have any, right? But I do work with a lot of individuals that want to maintain their hair. And I work with a lot of people in the field, longevity clinics, as well as hair loss surgeons. And I'm always canvassing the literature as well as treatment protocols to see what's most effective. So it's well known that minoxidil, ketoconazole, and finasteride work well. And that's something that you can do to maintain the hair you have on your head. Minoxidil works primarily it does work on many areas of your scalp, but primarily on the crown. Finasteride may help with the frontal area of your scalp. But one thing that seems to be an issue with a lot of patients, this is a question that comes up, is there a way to avoid the messiness of minoxidil? Is there another form of taking it? And in fact, there is oral minoxidil. And in the past, I was a little hesitant to recommend it because oral minoxidil, it was initially used as a blood pressure medication, and it has some unfortunate side effects, one of which is at high doses, it can be linked to edema and some pericardial effusions, right? But what they found is that at low doses, the likelihood of those things occurring is almost zero. Pericardium is a layer of tissue on the outside of the heart, and it's kind of this little sac that the heart beats within. In pathologic conditions, fluid accumulation can occur. And an effusion is where there is a tremendous amount of fluid within that bag that the heart beats within, and can compress its ability to contract in fluid. In extreme cases, it can essentially compress it so much that the heart stops, right? Oral minoxidil, on the other hand, at low doses, doesn't really seem to have any of those side effects. So this is a weekly treatment protocol journal that gets emailed to me, and you can get it in paper form. And they actually looked at a recent review article in the American Academy of Dermatology that looked at low-dose oral minoxidil for hair loss, and it was a multi-center study of 1,400 patients. And what they found was that low-dose oral minoxidil had an extremely safe profile for these individuals, and it was used on a wide variety of patients, both women and males. And what is low-dose minoxidil? Well, somewhere between 2.5 to 5 milligrams daily. And so the main answer that people are even looking for is there a way I can avoid doing the cream on my head and all the flakiness and the hassle? Well, there is, right? For females, somewhere between 0.5 milligrams and moving up to 2.5 milligrams is deemed extremely safe. And for males, somewhere between 2.5 to 5 milligrams is considered safe. For most clinics and most studies, somewhere a dose of 1.25 milligrams daily for females and 2.5 milligrams daily for males is a good balance in terms of decreased side effects, almost zero side effects, but still efficacy in terms of hair growth. So the reality is, yes, oral minoxidil is an option, and we are going to change the hair kit that's available on the refillsumma.com website to reflect that. We're not going to utilize the messy scalp minoxidil anymore and transition over to oral minoxidil.